Morning, everyone. I'm Rebecca Vickers, and on behalf of the Florida Alcohol and Drug Abuse Association, welcome to today's webinar. This webinar is being made available through a collaboration of the Florida Department of Children and Families, Office of Substance Abuse and Mental Health, and the Florida Alcohol and Drug Abuse Association. Please note that as an attendee, you are in listen-only mode and will only be able to view your name. If you have questions, please send them to me, the presenter, and the host by using the chat panel. The button to open the panel is usually located in the lower right side of your monitor. Please use the chat panel to send any questions you may have as you think of them. The presenter will address questions as time permits. Our audio is broadcast through the internet to your computer. If you experience poor computer audio, there are a few options to try on screen right now, and these options will be posted in the chat panel. If you continue to experience poor audio through your computer, try rejoining the webinar and use the I will call in telephone option. You must be connected to the audio of this presentation and view it on screen as well to receive a certificate of attendance. The recording and materials used in today's presentation will be available on the FADA website within 30 business days. To access the recording and PowerPoint, go to www.fada.org, then to our Resource Center, and then to our training library. FADA produces many webinars and workshops through the support of the Florida Department of Children and Families. To help participants track credits earned through attendance, we host an online community that provides a personalized digital journal where participants can maintain statements of credit for webinars and workshops taken through the Florida Alcohol and Drug Abuse Association. At the end of today's webinar, the web browser will direct everyone to an evaluation form on FADA's website. You will first need to register or sign into your account to complete the evaluation. Information you provide FADA as a part of registering remains confidential. Statements of credit will be posted within 30 business days after the evaluation closes. Completing the evaluation is necessary to receive CE credits or to access your statement of credit. Please note that the evaluation will close midnight, Monday, September 5th. Up to 2 continuing education credits are available for participating in today's webinar for persons licensed through the Board of Nursing, the Board of Clinical Social Work, Marriage and Family Therapy, and Mental Health Counseling, and for persons credentialed through the Florida Certification Board. If you are a licensed healthcare practitioner, be sure to include your Florida license numbers for reporting to CE Broker when you register with our site. If you are certified with the Florida Certification Board or licensed outside of the state of Florida, you do not need to provide your certification number when you register. Please note that Zoom monitors arrivals and departures of attendees and provides a report upon completion of the event. We are not permitted to provide a certificate of attendance if you do not attend the entire webinar, and we are not permitted to provide partial CE credit. Emily Hennessy, Ph.D., is an Associate Director of Biostatistics at the Recovery Research Institute and a member of the faculty at Harvard Medical School. Dr. Hennessy completed her Ph.D. in Community Research and Action at Vanderbilt University and a postdoctoral fellowship at the University of Cincinnati in the Sharp Lab. Dr. Hennessy primary area of research, adolescent substance use disorder, prevention, treatment, and recovery, is funded by a Career Development Award from the National Institute on Alcohol Abuse and Alcoholism. She is currently engaged in research that seeks to understand how recovery capital changes during the recovery process and how these changes can be facilitated by a community and system level of support. And now I'd like to welcome our presenter, Dr. Hennessy. I will turn the presentation over to you.
Great. Thank you, Rebecca, for that warm introduction. And it's a pleasure to be here with you all today to talk about how to really operationalize recovery capital in a process of measure and planning and engaging in it with folks that you're working with. So before I begin, I do want to acknowledge my collaborators in this work. I have been collaborating now for a while with Dr. David Best at Leeds Trinity University, and he has really pioneered a lot of what I'm going to be talking to you about today. And so I do want to acknowledge his work as well as that of Jessica Castile at Recovery Outcomes Institute Both of them are really integral in starting to operationalize some of the things I'll be talking about today. And then, of course, my work with John Kelly at the Recovery Research Institute, as well as broader work with folks in recovery, including those recovery support leaders and staff. I do need to acknowledge that I am supported by funding from NIAAA, but the content I'm presenting today is solely my responsibility and does not necessarily represent the official views of the National Institutes of Health. So today we have 3 primary objectives. The first is just to kind of give a quick background of the key components of recovery capital theory. And I realize for some of you, this may be a refresher on that theory, but it is really important to make sure everyone's on the same page in terms of understanding the different domains and dimensions, so that when we begin to talk about how to operationalize recovery capital theory, it all kind of clicks together and makes sense. The next objective is to dive into how the key components of recovery capital theory will inform the recap tool and what that recap tool looks like. And then I will be going through extensive examples and kind of demonstration of the use of a recap tool that's currently being used in several different settings for care planning around recovery. And so we'll see kind of these 9 primary sections today that will go into each of these in more detail, and we'll end with a quick review of some APA resources, as well as a sharing of the references that support the work I'm presenting today. So just to get everybody on the same page, when we're talking about recovery, I'm using a really broad kind of holistic definition, and the 2 definitions that I like to focus on are those that emphasize that holistic perspective of recovery. So the first is from 2007, the Betty Ford Institute Consensus Panel, where recovery is a voluntarily maintained lifestyle which is characterized by sobriety, but also personal health and citizenship. So not just a focus on not using substances, but really, you know, how is one's health and overall well-being beyond substance use? And SAMHSA has kind of a similar definition, really emphasizing that recovery is a process of change. And that's what we'll be talking a lot about today, because we expect to see recovery capital change as the recovery journey continues. And so SAMHSA emphasizes that piece of change, as well as how individuals are improving their health and wellness, living a self-directed life, and striving to reach their full potential. And so both of those definitions are important just to kind of set the stage for what we're going to be talking about today. The other piece I wanted to kind of emphasize is I will be using this term recovery navigator throughout. And you could think about this as it's not a formal definition, but the way I'm thinking about it is that it's a person who will champion and guide the recovery process by supporting another person to address barriers and unmet needs and build the resources they need to sustain and enhance the recovery journey. And recovery navigators can also be in recovery, but they may not be. And so I just want to, I'm going to be using that term, and I wanted to recognize and lay a little bit of groundwork for y'all there. So a very important piece that's come out of the literature recently is around how we think about kind of the engine of change, a process of change that happens in recovery. And on the left-hand side, you can see the measure, plan, engage, and that's really where we assess, we create action plans, and we engage folks. But the real work of that is in what happens next, this idea of chime. And that's been recently proposed by David Best and Mike Wheatley and some of the work that they've been doing. And so essentially it has this connection, this initial connection that allows individuals to build relationships with others and feel connection in their lives and in their social environments. And this results in a process of hope building, where they have hope for the future. They have a sense that there is something to look forward to. And this can really essentially drive their ability to create meaning in their life and to be engaged in activities that will generate meaning. And all of that kind of leads to individual empowerment, so the feeling that they are in control and they can have control over their future. And this will also drive who they are, their identity, their own kind of personal identity and what they align with, as well as their kind of identity in the social world. But we see this measure, plan, and engage kind of process as really kind of the starter for this, for what happens during Chime and for what happens as you're kind of building recovery capital through this journey. And so that's kind of how I wanted to set the stage for you all here, is just have that kind of perspective in mind when we're talking about the other aspects of measure, plan, and engage. So that should bring us now to the quick overview of recovery capital theory and what I'm talking about when I am discussing different domains of recovery capital theory. And so, as some of you may already know, this was developed in the 90s by some sociologists. They had studied mostly middle-aged men who were primarily white, and they had reported going through a recovery kind of experience without any sort of formal treatment. And so they were termed, Cloud and Granfield termed them kind of natural recoverers, and that they didn't go through treatment and they were able to recover without that. And what they posited as a result of that work is that those individuals had a certain level of recovery capital, so resources essentially, that enabled them to overcome their dependence on substances without that treatment. And what they went further to suggest is that we all have some level of recovery capital, and that's going to vary quite a bit. And so for folks with less recovery capital, there may be a need to step in with additional resources to kind of build those recovery capital resources up. And so the resources can be both tangible and intangible. So I'll go into details in the next few slides over what some examples of those, but essentially it's, those things that folks have access to or can access through their networks to support their recovery. One of the really nice things about thinking about recovery from a recovery capital lens is that it considers the individual within their larger context. And so it does account for not just the internal resources that they bring to the table, but what's in their larger environment, kind of the broader environmental culture and resources and supports that they have access to. What the theory also posits is that individuals with some resources are also likely to be able to generate more in kind of this synergistic effect. So as folks kind of begin to build resources from existing resources, you see that the change could happen kind of exponentially, so that they have this synergy and this energy that's developed, and they're really able to begin to move forward more quickly in their recovery journey. And so obviously recovery capital is thought to be this really kind of dynamic concept that's going to change over time, change during the recovery journey, just like we would expect the recovery journey to be changing itself. And so folks we would expect to see different levels of recovery capital depending on changes that individuals make in their lives, any new context that they're a part of, and any, barriers or opportunities that come their way. We would expect all of those things to influence recovery capital, and in turn, that recovery capital to influence their own recovery journey. And so essentially, from the recovery capital model kind of perspective, there is this sense of kind of personal recovery capital, which has two dimensions, so human and financial, that I'll go into in a moment. And then we think about that being within this larger layer of social recovery capital, those interpersonal contexts that we all, live, work, and play in, basically. And then we think about kind of broader than that, the broader community level that enables some different types of social recovery capital to be generated, and also can provide access to different sources of personal recovery capital as well, and different opportunities for developing that personal recovery capital. So when I'm talking about human recovery capital within the lens of personal recovery capital, we're really talking about having self-confidence and motivation for recovery, as well as kind of broader life goals, having good mental, physical, and cognitive health, so that folks feel energized when they wake up in the morning, have the energy to do what they need, don't feel the effects of mental health symptoms like stress and anxiety, or if they do, they know how to cope with those. Another aspect of human recovery capital is whether or not they have some sort of job skills, and whether or not they're employable, to kind of help build their financial recovery capital to get them access to resources. And then the last piece of human recovery capital that I'll touch on is spiritual beliefs. And obviously this is going to vary from individual to individual, and it's going to be different by culture. But for some folks, having some sort of spirituality or religion or faith-based beliefs can really, for them, start to build that kind of internal recovery capital and strengths, as well as provide some linkages to broader social recovery capital supports. If you think about folks, participating in, mosque or church activities, those sorts of things can help build that social recovery capital as well. So these are kind of the more intangible aspects of personal recovery capital. Moving on to the tangible aspects of personal recovery capital, we come to financial recovery capital. Sometimes it's termed physical recovery capital, but that really is just an indication of the type of tangible resources and materials that an individual has to use in their recovery journey. And so that's going to include things like having a stable income and good education to provide them with the kind of background they need to get the job, to get the income that they'll need to support themselves, whether or not they have a stable and safe living environment where they can get the rest that they need and have access to the healthy foods that they want to eat. And then some of these things are gonna the certain level of income and job will lead to good health insurance that will enable them to have access to evidence-based treatments that don't they're not on a waiting list for a long time. And the last piece of financial recovery capital, is really the aspect of whether or not they have reliable transportation in terms of public transit services, or if they're in a more rural area, whether they have a car and gas money to put in that car to get places. Because for individuals that are, trying to get to work or to a treatment or to a recovery service, the last thing they want is to be dealing with car troubles, right? And so those kind of very basic tangible resources are a form of financial recovery capital because they can help support an individual as they're going about their day-to-day recovery journey. Thinking beyond kind of the personal recovery capital, we move on to social recovery capital. There's kind of different aspects of what social recovery capital looks like, but essentially it's those supportive relationships that provide the kind of emotional and other kind of support that individuals need in their day-to-day lives. So that would include having supportive friends that maybe are in recovery or just not using substances. For some folks, it'll be having a supportive family or maybe friends that they view as family. So whoever can kind of be in their lives and give them that that support that doesn't change, that those sorts of relationships can be really important. Having the opportunity to engage in social groups that aren't around substances, if you think about if they're employed and they're friends with their colleagues and their work has a happy hour, that could be kind of a risk for their own recovery. And so if there are opportunities for them, even through their work or other social environment, to get engaged in enjoyable activities, build those meaningful social connections, and continue their recovery journey. And as well as kind of whether their home environment where they live, who they live with, supports their recovery. So if they have a spouse or if they're living with roommates or friends or children, even whether or not those folks support the recovery and kind of are committed to helping them in that by not having substances in the house and by not kind of encouraging them to have them in the house. And so that kind of moves us beyond the interpersonal level to really thinking about the broader community level. And so this map is from kind of where we see recovery high schools, actually, so for youth in recovery. But if we're thinking about for adults in recovery, there could be several different kinds of community recovery capital resources. So recovery residences, there are many spread across the United States. It would be relevant here, as well as kind of other self-help or mutual aid groups like 12 Steps or Smart Recovery or Dharma Recovery, all those sorts of different avenues for recovery that are social and supportive and help to kind of build one's social recovery capital by helping people to make those new connections and also to feel comfortable in having a positive recovery identity. And to just engage in fun things and get involved in their communities. And so this is kind of the broader system level, what in a neighborhood or a city or a state, what are the resources that are available for recovery, building recovery capital kind of at the community level, and what's the overall culture around recovery, and is it highly stigmatized to be in recovery, or are there kind of these positive social groups for folks to get engaged in and feel really supported? And so, what's wonderful about recovery capital theory is that it is so broad and it does really think about the person within their context, and it has kind of, what I like to think of really kind of lofty ideas that everybody kind of loves, right? I don't think, I'm not sure, but I feel as though people would not disagree that all of these things that I've been talking about are really positive, good things to have in one's life. And yet, because it is so broad, and such a strengths-based way to look at it, we also need to be careful about not just kind of throwing all this out there and seeing what sticks. So we do need to have a systematic and rigorous way to measure recovery capital and assess how it changes over time so that we can really demonstrate that what we're seeing in terms of recovery capital changes is linked to recovery outcomes. And so we also need ways to really actively intervene to help others build recovery capital as we see that it does help one's recovery journey. And we also really need to think about how to use the building of recovery capital as a marker of kind of readiness to move on to the next stage of one's recovery journey, as well as how to use it throughout the recovery planning process so that folks can see targeted goals being met and then being able to set new ones. And so what's wonderful about recovery capital is that it does really help individuals identify opportunities for growth and overall strength. So it is that kind of strengths-based holistic perspective. But on the flip side, it can also help us identify opportunities where there are barriers and where communities and others can maybe step in and provide linkages or active supports to help assist in the building of recovery capital. And so before we go on to kind of the next section, which will be talking more in depth about a tool to do the things that I just talked about, I did want to kind of shift the attention a little bit to just remind folks of the recovery management philosophy, because this is really the piece where we're thinking about recovery on a continuum, where there is a process from kind of think about all the way from pre-recovery and to what SAMHSA has indicated as, what we consider maybe full citizenship, where someone's really kind of stable in their recovery and they've moved on through this process and have kind of feel really confident in that recovery journey. And so what I'll be talking about today could apply to folks like in these very professional settings, as well as members of our communities, because the recovery management philosophy really attempts to kind of shift the focus of care from, these acute symptom stabilization sessions where it's very professional centered. We're really working with a client to help them direct the management of their long-term recovery and what they see as those long-term goals. And so the idea is to kind of acknowledge the importance of having traditional treatment, but also acknowledge the importance of having a sustained continuum to meet people where they're at when they're not in those services, or to get them back into those services when they could use that linkage. And so ultimately what we want to do is make sure that we have the breadth of support services that an individual needs to enhance the strength and stability of both initiating their recovery, maintaining their recovery, and if they return to use and want to initiate their recovery again, the open door for them to come back and do so. And I think the recap tool that I'll be talking about now really provides a tool and a way to begin to do that. And so that's where we're going to pivot a bit now and talk more in depth about using the recap tool to measure, plan, and engage. But before I do that, I just wanted to do a quick check-in with the audience and see if there were any questions. And I realize it's still fairly early in the talk, so I don't expect any, but I'm happy to take any now. And there'll be several other times for questions as well as I'm talking. So I'll just give people a moment to enter something in the chat if they had a question. Okay, well, I don't see anything, and that's totally fine. So I'll just move on to the next section, and at the next question break, I can take questions then if there are questions. So now now that we've seen kind of the lofty goals of recovery capital, let's really drill down a little bit into how to operationalize it through the recap tool. And so at its very base, if we're thinking about, what is this thing that I'm talking about, the recap, okay? The essential point is that it will begin to measure acute need and barriers first so that those can be addressed first through active linkage to the supports programs and organizations that can address this. And so as we're measuring these areas of acute need and barriers, we're also measuring areas of strengths, because the idea is that you can actually use a person's existing strengths to help build more strengths. And in doing so, especially if you can begin to just build kind of those easy wins, they can gain momentum in that recovery capital building process and, feel increasingly motivated, increasingly supportive, and really feeling like there is a way for them to proceed in this journey with the recovery navigator as their support system, and with those others who they've chosen to bring along with them in that journey. And so the recap itself was developed and kind of validated and initially presented in this Cano et al. Article in 2017. And so the version that I'll be presenting to you today, I'll go over all of these different sections, and I will acknowledge that we've actually made some changes to the original version that's presented in the Cano article, given the population that I've been working with specifically in drug treatment courts. And what's nice about the Cano tool is that there are opportunities to make some substitutions, to make some changes depending on the population that you're working with. But I'll kind of present the overall tool so you get a sense of how it fits together and kind of the rationale for each of these different sections. And so the first section is really just a quick check-in, demographic question, characteristics and questions. So there's 4 questions. And essentially this isn't really part of the measure, plan, engage process. But if you do this, if you're thinking about implementing a tool like this at the organizational level, it will allow you to look at responses for individuals of certain population groups and see if perhaps you'll need to make some changes in terms of the supports that folks indicate they need. So if you think about maybe different genders or different members of racial or ethnic groups, if you have enough folks that have completed this and you look at their recovery capital barriers and strengths over time, you could begin to maybe see where you might need to add in some additional sections for different population groups. But the next section, section 2, which focuses on quality of life and satisfaction, really kind of dives into the beginning of assessment of recovery capital. And so the first 5 questions were adapted from the WHO quality of life, the brief scale, which was validated. And so I'll walk you all through each of these sections in a few moments in more detail, but that's the essentially short, quick assessment of kind of a snapshot of quality of life on that day. The next section does dive into those barriers to recovery. There's 5 different kind of subsections within this that I'll go through in more detail, and this was adapted from the treatment outcome profile, another validated measure. Section 4 involves 8 questions that ask about services involvement of individuals, and it also asks about if people are involved, their satisfaction with those services, and whether or not they have additional needs that aren't being met through use of those services. The next section is focused on personal recovery capital. And so it's essentially the 25 questions from the validated assessment of recovery capital scale that tap into that personal recovery capital domain. And so that'll be a quick assessment of those kind of internal assets that an individual has for their recovery. And again, that scale has been validated, and it's used pretty extensively on a global scale for different recovery populations. So the section that follows, section 6, addresses assessing social recovery capital, and it's another 25 questions that dig into those, again, from the assessment of recovery capital scale. Section 7 is the involvement with recovery groups and your local community section. So really kind of thinking about how to assess community involvement and what that looks like in terms of one's engagement with recovery groups and with other kind of broader groups in the community, because the assessment of recovery capital in the previous sections doesn't actually tap into those measures. So that's comprised of the recovery group participation scale, which is 17 questions, as well as some open-ended questions, and then a short kind of support from others scale that taps into different types of support services from others. The last kind of more quantitative survey section of the recap tool is section 8. It's a commitment to sobriety scale that was validated by Kelly and Green back in 2013. It's a subset of those items. I think it's only 5 questions. And then the final section in the overall tool, if you're just doing the assessment part of things, the measure part of things, is 4 kind of open-ended questions, 4 or 5, depending on the population you're working with, that really allow a person to begin to kind of reflect on their recovery journey and kind of other, what they see as kind of other needs in their lives that aren't maybe tapped into with the questions in the other sections. So before I, talk about each of these sections in detail, what I wanted to do is just go over a little bit of the evidence base, because this is a tool that's being used in several different research studies, actually, and it's been used in both the UK as well as the United States. And so we have study with recovery residences, as well as some studies with some incarcerated or kind of folks that are supervised in the criminal justice system. And so one of the studies I wanted to make sure to cover was kind of really the initial study where this tool was initiated and kind of validated. So this was among 8 recovery residences in Florida for a sample size of 546 participants. Majority of them were male and about 33 years old. And 23% had reported substance use in the previous 3 months. This study was a cross-sectional sample, so any of the relationships are correlational, but the authors found that levels of recovery capital was highly correlated with positive well-being. So higher recovery capital was more highly correlated with high well-being. And when they looked at, although it was cross-sectional, they were able to look at the length of time that someone had been in the residence at the time of doing the recap. And they found that the length of time in the residence, more time in the residence, increased the meaningful activities that a person was engaged in, and also seemed to indicate a decrease of recovery barriers compared to folks that were there for a shorter amount of time. And they also found that this kind of indicated a reduced number of unmet needs. And so overall, this is some support for folks that choose to engage in a recovery residence in Florida and also maybe stay there for a longer amount of time. There's a new study that came out with a same kind of sample. It's a longitudinal sample of recovery residences in Florida. And it really enables us to get more of a view of what kind of changes in recovery capital could indicate for folks. And so this one, we can see that at baseline, there were 823 residents of these different Florida recovery residences. And then at 6 months, there was a sample of, just under 300. And so we do see a large amount of attrition, and it's not clear from the way the data were collected whether or not that's as a result of folks that left the residence or just decided not to do the recap. So we have to review these results with, just a grain of salt here. Overall, the most of the sample was primarily male, and it was a bit older than the previous sample, so closer to 40 than closer to 30 in this case. And what the authors of this study found, which is just out like 2 or 3 weeks ago, is that increased recovery capital, according to the recap, was associated with increased recovery group participation. Folks that were able to work full-time also experienced, indicated increased recovery capital, having a higher rated quality of life and greater social support. So the recap helped assess these things so that folks could kind of point to these meaningful changes in their day-to-day lives. The recap was also implemented in a recovery prison in the UK. It's a HMP home house. And this was more of a feasibility study just to see, in this somewhat negatively focused system that's attempting to be, really recovery focused and very positive, is something like the recap a useful tool for this setting? And what this study found is that it is acceptable to staff as well as to those who are incarcerated in that setting. And in this study, they were actually able to train peer supporters in the prison to be recovery navigators. So different folks that were incarcerated could be recovery navigators for other individuals, and that seemed to go really well. And those peer supporters were very positive about that experience. And so it suggests that the recap is a tool that can translate pretty well in these settings, and also really enable folks that are, not necessarily licensed to implement the recap in a way that enables there to be a positive experience for folks. And so the last study I wanted to talk about is one that I'm currently involved with, which essentially we just worked for the past year and a half about implementing the recap into the drug treatment court system in New England. So it was 2 federal drug treatment courts. And as part of this evaluation work, we were working with a total of 9 court staff, which is pretty much the judge and the probation officers and anyone else who's kind of supporting the drug treatment court activities, as well as the clients that were engaged in the courts in the past year. And so to date, that's been 22 participants. So these are kind of smaller courts, so smaller sample than the Florida recovery residences, but a highly vulnerable population. And so in this work, we did extensive work with the staff on training on how to use the recap, and then kind of evaluating and doing some focus groups to see how the recap went for them, and what sorts of barriers they might have experienced in implementing it, and ultimately if they felt it was useful to their work. And so overall, the court staff, they're still implementing it, so we're going to be engaging in more of an outcomes-based study now, but the staff to date really felt that the recap did provide a structure as well as a positive orientation to the drug treatment court work. They felt it actually helped them create kind of more structured court procedures in terms of thinking about goal building and working towards those goals. The court staff also talked about how they felt like it did improve their ability to generate a new relationship with new clients, to kind of get on the same page with them. There were some potential barriers though that were noted, so I just want to bring these up because it's just important to kind of acknowledge and think through how to think about this in the context of using a strengths-based tool with this population. So some of the court staff did feel if clients weren't comfortable answering honestly, or maybe were kind of overly positive, it could present a overly rosy picture of their experience. And so some of the POs were kind of cognizant of that and wary of that, and wanted to be careful of that when working with their client to develop goals. And then in some cases, they actually had to help with completing the recap because of the literacy issues with their clients. So some of the clients maybe were unable to read, or also English was not a first language. And so the recap tool, they had to kind of sit down and actually go through question by question versus asking the client to fill it out themselves and then review the answers with them. But ultimately, they did feel it helped their structures and procedures, given some kind of small modifications to their own, the way they envisioned using it. And so, throughout when I'm talking about the tool itself and then going through the example, I do want to encourage folks who are on the call to really think about how this could be adapted for the target group, because yes, there are some kind of standardized and validated surveys that are used for the different sections, but there's also some wiggle room in terms of thinking through things that might be important for a specific population. And so whenever thinking about using a strengths-based tool, with different populations, obviously consider what areas of recovery capital might be most salient for those folks, whether or not there, are known or additional kind of gaps in recovery capital for a particular population. So for justice involved individuals, there are kind of extra barriers to getting employment, the kinds of jobs that they can get engaged in. And so knowing that going in and crafting a few questions to address those barriers are important. And then also some areas where you could think about building on existing recovery capital that's not maybe captured in the measure when considering different cultural or developmental aspects of questions or responses. Those are all kind of things to think about if you want to use a recap. What might be some ways that you should adapt it to work specifically with folks you want to work with. Okay, so I see it is time for some questions, and I think I saw one in the. Yes, okay. So someone has asked, is the tool that lists the sections 1 to 9 with the different, yes. So this is the overall recap tool, and it has different sections which are different validated questions. But it essentially, what the tool will do at the very end, and you'll see this as I go through the example, it will score all of these and combine the scores in a way that provides kind of this overall assessment of recovery capital, and then a breakdown of these different domains. And so someone else has asked, where do we find the actual assessment? It is something that is, it's kind of I'll be honest, it's scattered throughout some of the literature. But I'm happy to share some resources, and then I'm also happy to share a copy of the questions with you all, as well as some other materials after the talk. And I know Rebecca has put in the chat the link to today's PowerPoint as well. But so yes, to the initial question, it's a tool that's made up of these different questionnaires that then gets combined into a summary report that I'll go over. Okay, so someone has asked, it's a great question. Can you speak towards the generalizability or applicability of this tool for the college student population? Most of these settings seem to be situated in the treatment recovery setting, kind of continuum of care, which is a very intentional setting, obviously, and unidimensional compared to college, which I realize has a lot of risks kind of inherent in the environment. And so yeah, I'm happy to talk more about that. In my own work, I've thought about how this tool could be adapted for adolescents specifically, because they are kind of a unique population, and some of which kind of bleeds into that college age environment. I will say the recap has not been used in a college setting, so I can't speak to the validation. But if you think about the way these different scales could indicate sources of strengths or barriers, there could be specific ways to use it and to adapt it to a college population, because essentially we're looking at things like quality of life and kind of overall satisfaction. Some of the barriers to recovery, I think, could be adapted for where youth in college settings would have additional barriers. And so you could kind of think about going beyond the treatment outcome profile from which this was adapted, and really thinking about the kinds of services that are available in both section 3 and 4. And then section 7 that focuses on involvement with recovery groups and local community. You could also think about adapting to a different, some different types of kind of recovery group questions. But I can, as we go through the items, because I will go through each of the, the sections in more detail in a second, then you can, I think, hopefully begin to see how there might be some wiggle room in terms of adapting some of these for younger populations, or for older populations as well, for those of you who might work with folks that are that are older, an older population. Okay. So now we get on to actually using the recap as a measure, and this is where I'll provide a lot more specific information about each of those sections. But before I do that, I do want to say, if you're working with an individual and you're going to be doing the recap, what we emphasize in this process is really beginning to work with them with kind of a learning and growth mindset for this phase. So this is an assessment. They are going to see what we call scores, but it's not a test of like who they are or how well they're doing in life. This really enables us to learn where their recovery capital strengths to build on, as well as recovery capital gaps that community supports could help to build through the linkage of a recovery navigator. And what we'd like to tell people is, all scores, of course, can always be improved, and that's something that we'll see as we work together in kind of building recovery capital. And so really the ability to kind of think about these questions and reflect on them and be honest with yourself kind of about where you are in this process can help move this process along. Because if there are barriers that don't come up on this that someone knows about and they just don't feel like sharing, then that's going to be a space where the recovery navigator wouldn't have been able to support the person where maybe they could have if they had known that there was that barrier there. Okay, so the fundamental basis for the recap is really to measure where each person scores on we think about them as 6 dimensions because it's positive and negative, personal, social, and community recovery capital. But we also need to remember that the main aim is really to identify the strengths and use those strengths to overcome unmet needs and barriers and to build new strengths. And so the other crucial thing that we like to emphasize with folks is that recovery really can be grown from the outside in, because if we think about, early on in recovery journeys, people are often short of confidence and maybe some self-esteem, motivation, and that could be because they also lack positive social supports and may feel excluded and isolated. And so recovery theory really dives into thinking about how we can help people early on build enough recovery capital and supports for it to be self-sustaining. So in other words, for many people, there will need to be some level of kind of external supports and resources provided and used during this time as they kind of gradually build those internal strengths like coping skills and resilience that will allow them to deal with adversities down the line. And of course, in this process, remembering that recovery is not linear. There will be dips and obstacles. So sometimes folks will see that recovery capital score, go up and then go down, and really having a space for them to reflect on that and move forward with the support of Recovery Navigator is where we like to see this recap tool being used, because the process is really about building the frameworks around measuring and assessing that to create those partnerships and build community connections to support the person in their recovery journey. And so with that in mind, this is kind of a generic, if you would be walking someone through this and they would be completing it on their own, or if you as a recovery navigator were sitting with them, we like to have some sort of introductory information just to give them an opportunity to put themselves in the mindset of how to complete the questions that they'll be completing. And so like to have an initial brief definition of recovery, because recovery is a term that's used throughout. And then just really, why and what we're doing. So we're introducing a strengths-based way of assessing your abilities and skills and resources to help us support you to achieve your goals. And the assessment is called the recap. And so obviously, the next section, which talks about doing this every 3 months, is something that could vary depending on the organization, that if you're working as part of an organization, and the length of time as well. If you're piloting this tool with a population and you're realizing it takes a little bit longer, then you'd want to indicate that. And of course, recognizing that and letting people know that the staff or whoever's working with them might see those answers will help people feel comfortable with that process. And you could also have a discussion with them about that. This is a tool that we can do together and assess and reflect together on. And so the next piece, depends a little bit on how you plan to use the results. So in our case, we really talk about it allowing us to create a strengths profile to help develop a recovery care plan to support their recovery journey, and that they're going to be discussing the plan and using this to help develop their own action plan with the staff member. And then just kind of ending with, a why, why are we doing this? Why is this important? And who to contact for questions. So that's kind of just an opening face page example. You all will have this in the slides after the talk if you decide to move forward with this, but just something to kind of frame it for the person versus just, handing them a stack of questions to complete can be really helpful. And so I mentioned that section 1 is just that basic demographic characteristics. We've chosen to use the ones from the NIH All of Us survey, which has a kind of some more extensive options for race and ethnicity that actually aren't reflected in this sheet, but I'm happy to share those with folks in the future if you're interested. But so essentially, as a reminder, this just kind of gets a quick snapshot of the population that you're working with, and if you want to look at recovery capital growth over time and for different subgroups of kind of a larger heterogeneous population, these are the kinds of things you'd want to collect briefly and at the very beginning, just so you have them. And as I mentioned, the next section really dives into that quality of life and satisfaction. And so we use these 5 brief measures of health and well-being to just get a quick global sense of how people feel on that day. These indicators are on a sliding ruler, and so we expect that folks would change in these scores over time. The total score that's produced at the end from these items is summed and averaged for a total score of 100 that gives us a basic overall metric of well-being and quality of life, where higher scores indicate higher well-being on that day. And so, it asks quickly, psychological health, physical health, overall quality of life, and the quality of one's housing. And so it's nice to kind of start with those kind of broader questions, and then we do turn to addressing acute barriers and ongoing challenges, because we want to make sure that we're addressing those, measuring those, and getting an accurate read of those before moving on to building on the strengths. And so the barriers to recovery section actually has 5 different recovery barriers. And so the first piece that appears is really just, the ability for an individual to go about their day-to-day life, and that's whether or not they have a stable living environment. Because if there's a problem with their living environment, a lot of other making change in other areas is obviously going to be very difficult. And so we ask about being at risk for eviction, at risk of street homelessness. There's another question about if an individual has problems securing housing because of debt. And then there are a few questions around who they live with, as well as how many days they've been living in these different places. The next piece of the section is really an additional, obviously barrier to recovery is if there's ongoing substance use. And so this is a snapshot of the full list of substances. And so essentially the way it works is they'll indicate whether or not they've used substances in the last 90 days, and then they can indicate which of these substances that they've used, if it's ever been a problem. If they indicate that they've used it in the last 90 days, how many days they've used it, as well as kind of the average daily amount they'll be prompted to fill out. And so different, and working with different organizations with this tool, we have changed the list of substances that are asked, or the terms that we use to ask about these substances. And so that's something just to keep in mind if you're thinking about using this. That kind of thing can be flexible. In terms of use of medications for opioid use disorder, obviously those would not be counted as barriers, because if those are prescribed for that disorder, we would just want to capture it here so that whoever is working with that individual would have a sense of any sort of additional needs, supports, or barriers related to their access to medication use, because that could influence, where they're looking for work and those sorts of things. And so that's kind of accounted for in the scoring process as well. The next dimension of barriers to recovery is their injection drug behaviors. And so getting a sense of whether or not, if they're using injection, if they're injecting their drugs, if they've injected with a needle or syringe that's used by someone else, or equipment that's used by someone else. That's a good place to kind of assess this and see if there might be some other harm reduction support strategies that could be in place. But just knowing whether or not this is going on is helpful, and from a recovery capital perspective and addressing immediate barriers. The next section that addresses barriers is around criminal justice involvement, because we recognize that for folks that have a substance use disorder and are involved with the criminal justice system, whether or not that's a drug treatment court or a different part of the system, it's really important to know what level of involvement they have, as this can be a huge barrier to employment and access to housing and all those sorts of things. So this is measured as another potential barrier. And the section closes with whether or not folks are engaged in meaningful activities. Because what we know about recovery is that having a lack of meaningful activities in their lives, and a sense of boredom as a result of those, can be a huge barrier to the recovery process. And so in this case, we ask if they're attending school, working full or part-time, or volunteering. And where these are all no's, that's where you would want to start to think about ways to get folks engaged in some meaningful activities, because again, that can be a huge barrier to the recovery process. The next section really moves on to thinking about what kinds of services. So it could be formalized services, and there's also parts of this section that are around informal or more informal supports. So assessing what sort of ongoing professional support they're using and whether they need additional support. And so this is just a snapshot again, but folks would be asked to think about, for each of these, drug treatment services, alcohol treatment services, housing support. There's also ones around family support services and employability, and there's an other option. If they're currently engaged with this kind of service, if they say yes, they're prompted to answer whether or not they're satisfied with the service they're getting. And either way, they're also prompted to answer whether they need help or additional help in this area. So they could be receiving drug treatment services, and maybe they still feel like those needs aren't being met. And so assessing that here is a great way to identify those unmet needs that perhaps could be addressed through active linkage by the recovery capital navigator. And one thing that's important to acknowledge is really, they could be engaged in these services, but really need help kind of with the logistics of getting to these services. And that's the kind of thing that they could indicate through this responses to these questions is, how could we help you get to these services, or how can we help you remember to go to these services? Do you need us to help you create an initial appointment? Those sorts of things could all be kind of captured in this sense, or through this measure. After assessing those specific services, involvements, and needs, we then move to this broader sense of assessing personal recovery capital. So this is again from that scale. And so we ask individuals to read the statements and just kind of give a quick initial feeling at that moment, whether they agree or disagree with the statement. And it should kind of reflect how they've been feeling in the last 3 months or so. So again, there's 25 questions, but the 25 questions actually can be summarized kind of overall as one personal recovery capital score, but also into 5 different domains. And those are an individual's recovery experience, their level of physical health, their level of psychological health, their degree of kind of risk taking, as well as their coping and life functioning. And after they complete the personal recovery capital section, they move on to social recovery capital. And again, it's meant to just be a snapshot of how they feel when they read that statement, whether or not they agree or disagree. And so again, it's 25 questions, and these can also be summarized overall, but then in these 5 different domains, and that includes one's engagement in meaningful activities, housing and safety, citizenship and community involvement, social support, and substance use and sobriety. And so I did want to mention, very briefly, this is a validated scale, but some of the wording, obviously, we could, if folks are interested in using this, could be reframed, because some words around, clean or dirty from drug use, that, as indicated here on the slide, could be very stigmatizing for groups. And so I did want to acknowledge that here, that wording could be adapted for different populations. So this next section, we are getting towards the end of the tool. There's 9 sections of assessment. This is the one that focuses on involvement with recovery groups in your local community. And so this is from the Recovery Group Participation Scale. It has 17 items. It was published in 2011 and really designed to capture involvement and engagement with recovery-specific community supports. And so, the instructions really prompt to refer to any group, formal or informal, and some of the examples are AA, NA, Smart Recovery, local peer groups, aftercare groups. But those sorts of examples, I think, could be expanded if you're working with, perhaps a younger population. You'd want to think about collegiate recovery communities or other options for those groups. So they think about those recovery groups as they're completing this questionnaire. And what's kind of important to note about this is that, it is a good indicator of community recovery capital, but some individuals may really not feel that recovery specific supports, like the ones mentioned here, are available or really of interest to them in their community. And so really using this as a tool to talk with them about other ways to engage in community services, if they end up having kind of a lower community recovery capital scale, may help them to get better linked up with more tailored supports that they would actually engage in, right? It's no use to recommend that they attend a local AA meeting if they're just not interested in attending AA, or if, if they're on medication for opioid use disorder and have tried the NA meeting and really feel like it doesn't, they don't feel comfortable there. This is the place to kind of begin to have that conversation once you're reviewing the results around what sorts of recovery supports or other community level supports would support your recovery journey. And so this next piece of the tool does kind of get more of that open-ended sense of whether or not people need additional support from these other supports, like peer support, 12 steps, community recovery groups, online recovery groups. And then there's several open-ended boxes as well to indicate what kinds of supports they've utilized in the community. So the last quantitative measure in this section on recovery groups is just a quick sense of areas of other support that may or may not be recovery specific, but it's really around different kinds of supports that people would need in their day-to-day life, right? So emotional support, help you need, resources, advice. Quick snapshot of these different areas that we all kind of need on a day-to-day basis and are captured here to get a good sense of that. Now, the last quantitative measure in the tool is this section 8. It's on commitment to sobriety. And again, it's a validated scale, but obviously looking at the question here, you might want to adapt some of the wording to use kind of that stigmatizing language. So essentially it asks for each of the questions below, give a rating on the scale for how you're feeling about the question today, right in that moment. And so in the paper that validated and kind of presented this scale, what we see is a different range of means for different substances when people are kind of initiating their recovery journey. This scale has a max of 30. And what we saw in the validation paper, the ranges for different substances that folks were on in terms of their level of commitment to sobriety was between 21 to 25. And so if you're just looking at this commitment scale for someone, if someone has a score of like 25 or higher, you would say, oh, that's a really high level of commitment to sobriety. It seems like they're maybe more in an action-oriented phase of things. So that's kind of a quick marker of where they are thinking about their level of substance use. So the last section of the tool is really this opportunity to get people to respond in their own words about where they see themselves in their recovery journey, their life goals, who they rely on to help with that journey and what they might need to get to that next goal in their journey. And the reason this is at the very end is of all the other measures is really to begin to get them to be in a more of a reflective mode, to really go back to why they might be involved in their recovery journey. We hope that it helps to identify things about their experience that the recap may not capture, but are really important to know in order to tailor our plans directly for them, and to really make sure that their individual and personal needs are included. And we see this part as really crucial in supporting the recovery capital navigators and helping people develop their own recovery plans and journeys, which is what the next section will actually dive into in a whole lot more detail, is how to take these results. You'll get to see the summary report and an example of how we would use that summary report to support someone in their recovery journey. And so I think now would be a good time for our break. The hour has actually flown by. I didn't even realize what time it was. Before we dive into the recap plan. And so I'll probably have people enter questions in the chat during the break, and then I can address them when we come back from the break.
Sounds good. Everyone, we will meet back from the break at 11:10. Welcome back, everyone, to today's webinar. Just a couple of quick reminders before we get started. A link to the PowerPoint is in the chat for you, and you are in listen-only mode. And now, Dr. Hennessy, if you're ready, I will turn it back over to you.
Thank you, Rebecca. Yeah, so I see there was one question in the chat around how long the model has been implemented and what is the ratio of success. And so it's a great question. You know, the initial kind of recap tool came out in 2017. And so obviously it's been a few years, but a lot of the work has really been around making sure that folks, that it's feasible, and kind of what that looks like in different settings. And so we don't have good kind of ratios of, you know, if you use this tool, someone's going to build the recovery capital and we're going to see recovery capital success. We just don't have those metrics at the moment, but that's certainly what we're building. I know there's been quite some very extensive work with recovery residences, and there is a lot of data. To my understanding, there's like thousands of cases, and it actually just kind of needs to be analyzed to look at folks over time and analyzing it in a way that enables us to actually account for differences across different settings, so that when we're talking about building a recovery capital and what supports that, we're taking into account kind of some system level differences. And let's see, I have a question here about assessing clients involved in the probation services with a felony. And let's see, in that process, they use an ISP, an individual supervision plan, and a worksheet that sounds like clients only fill out nominally, and that the probation officer may or may not look it over. And that these kinds of things kind of just go in their file. Yeah, this is a really good question. I'm gonna have to take a closer look at it. I can say that when we have been working with the drug treatment courts, and actually in some of my work with some juvenile drug treatment courts as well, it's really, if you're thinking about implementing this tool at a system level, it involves creating buy-in from the staff and kind of changing how operations and procedures are done, to have new structures so that this is an active part of the process. Because if you're just asking people to engage in this assessment, I mean, and you could see yourself as I was going through the questions, I think a few minutes ago, how long it takes, right? And so if you're asking them to complete all these questions and then you don't do anything with it, and they don't see any way that it changes their experience with the system, that's a lost opportunity. And it can also be a way to kind of feel disempowering for folks. And so we can follow up later on as well if you're interested in implementing it in a different setting, like Department of Corrections, that's not necessarily focused on recovery settings. Because the real important piece is not just doing the measure, but moving on to planning and engaging with folks to really engage them in this process of recovery planning. And so, you know, what we do is actually link the scores on the recap with a live recovery planning model, so that they can, an individual can see their own change over time, right? So thinking about how often to do this, we recommend every 90 days, about 3 months, which seems to align pretty well with some drug treatment services, and some kind of, if they're in a drug treatment court, those phase systems, those kind of tend to be key transition points. And also, I'm going to be talking about how we use those scores to engage in that planning, and further engage participants through the use of node link mapping, which is a more structured way to use the summary output than kind of this initial piece that I'll be sharing with you today. So the way that we have worked this out is the tool, you know, you saw the tool, we have implemented this electronically, so that it can provide an immediate score report for folks who are using this, so they can get that immediate impact input and begin to start planning. And in this process, we have harnessed the technology to enable there to be a traffic light system to really help folks kind of see where there are strengths and barriers pretty quickly. Because ultimately what you want to do is make sense of the score profile, see where someone is high and low, and then begin to identify what those specific strengths and barriers are. And so, we think about this in kind of an absolute sense where we can start with some initial thresholds for high, medium, and low in each of the domains, traffic light them, and then kind of begin to assess, which ones need to be addressed first and which ones can wait till later. And so in the summary report that I'll be sharing with you in a few minutes, anywhere it's high, it's going to be indicated in green. And so it's essentially a list of assets or resources that an individual has that could be used to help build their recovery capital and meet their personal goals. Medium, we think caution when we see yellow. So these are areas that are maybe not like a big strength or a big barrier, but they can become the focus once some of the initial kind of goals are met and some of those more acute red areas are gone from their profile. And then anywhere where we see red, that indicates they're kind of low on this, it's a barrier. And oftentimes those would be more of the acute issues that need to be addressed as soon as possible. Hopefully that we can use any of the strengths that were identified in the summary report, but also recognizing that there may be this additional need for a system level kind of assertive linkage for an individual, really harnessing some of those community level and formalized treatment supports and recovery supports. And so one more thing about scores, I mentioned at the beginning that it's not a test, it is an assessment, but we do use scores. And so if we're talking about whether or not a score is good or bad, it's really going to depend on the person. It's going to depend on where they are and where they've been and how it might compare to other people in the program at the same stage that they're at. And really that's not in the sense of comparing them to be directly comparative, but really just to get a sense of how folks might compare to others, like in early recovery versus like if we think about later recovery. And that can really only be done when we have, a good number of people in a similar program that have done the recap measure. It's not, if you're implementing this in your organization, it's not going to be after the first 5 people have done it that you'll get the sense of population norm. It really needs to be more people than that. So you can begin to get a sense of where people might fall on that recovery capital continuum as they enter the program and as they move through the program. And so the first part of working with an individual, once they've done the recap and have that summary report, which we'll go through in a minute, is just to begin to reflect with them on their goals and also begin to just go over with them maybe how realistic the goals are and what might be a good timeline for achieving them. And some of the node link mapping that I'll show towards the end is going to address that. You'll also want to talk about how they can reconcile the profile that's reported in the recap, so all those different scores, how they can look at those scores in light of goals and objectives. You're going to want to address those acute barriers, those ones that are identified in the traffic light system as red, because these will be the things that will stop the growth of strengths if they're not addressed pretty quickly. And that's where you're going to want to attend to those chronic and unmet needs. And so, the typical order of strength building from a recovery capital perspective in this journey is really beginning to make sure that that community recovery capital is built to support the development of social recovery capital, to further support the development of personal recovery capital. Right? So you want to build those social and external supports to have that foundation to support the internal skill and capability development. It's a social model of change and recovery. And as I mentioned at the beginning, any existing strengths, use those to build other strengths, right? Use those initial strengths to meet some short-term goals and get those quick wins. And then also as a recovery navigator perspective, if you're the one doing this with the individual, this is where you work on building relationships and assertively developing those community connections to help them meet those longer term goals. And throughout, we recommend not just doing this once, but really like doing this recap several times, across the year, to evaluate where people are doing well and where they may need more support and kind of give them that feedback. And what we want you to remember is the model is really designed so that it can be personalized. And that's why there will be a place for people to build their own individual goals, because this is where their motivation will lie, right? Beyond any sort of kind of reward system that the program itself has, if it's part of a more larger, more structured program. But this will be the motivation for them to really engage in the process. And it can also help build a relationship with that person and some sort of maybe therapeutic alliance between the person in recovery and the recovery navigator. So what I'm going to do is I'm going to go over an example of, it's a fictional summary report based on a fictional completion of the recap, and talk through each of the sections that you would see if you were using this electronic version with our fictional case, Kevin, and what his goals are. Okay. So a little bit of background of Kevin. He's a 35-year-old male who's starting a drug treatment program. He has had many unsuccessful substance use quit attempts in the community, has had a long history of multiple and comorbid substance use, and has been engaged off and on in different treatment services. And so he's now engaged in a drug treatment court because of a nonviolent criminal offense. And so what he would see after completing the recap, kind of that first summary page that he would want to review with his recovery navigator, is what he listed out as his future goals. And so in this case, we separate them out into kind of life goals and then also recovery and reentry goals. There's different ways to present these to folks, but that's kind of the first thing that they would want to see are those goals reflected back at them. And so what we see for Kevin, several of his goals are related to having more tangible forms of capital, like getting a job, getting his own place to live, and saving money. And he also wants to find a companion. And so these are goals that could be linked into some of the action steps that will come later in the summary report. And so now that you've reviewed those goals, it will be necessary to look at those acute crisis areas that are going to happen in nearly all recovery journeys before you can begin to transition to building strengths and resources. Okay, and so the barriers that the individual indicates in their survey will populate in their report automatically. And this is where you can begin to discuss these barriers in light of their goals. And so we do refer to these as acute barriers that must be addressed as part of the process of building recovery, especially if there's an ongoing substance use and unstable housing, both of which are going to be major barriers to building sustainable recovery. And it could be at this point that you kind of begin to discuss what the individual plans to do about these areas and think about the services that are available to help address these barriers. And so for Kevin, it indicates obviously, and this is reflected in his goal of wanting to get his own place. He has problems securing housing. He has used substances in the last 90 days, and he's also involved in the criminal justice system. Okay. And so in your conversation with Kevin to discuss these barriers, he might say, his priority is to resolve the housing issue. It may actually not be the substance use. It could be the housing issue. And what's notable is, thinking about how to connect these goals in conversation, right? So he mentions the housing issue, which is also his first aim of the goal, and he can link this to the other goal of cutting down his substance use to save money to find a place to live. And so this could be where there could be some working with Kevin around his motivation and his life goals. So after you've talked about his goals and his barriers, next we move on to a summary of services that the individual indicated they couldn't need more assistance from, and some potential supports specific to their area to direct them to so they could begin to get access to community support. So in Kevin's case, we see that 2 community service needs were identified: mental health treatment and employment services. And so these examples here are from some of this other project work that I've been engaged with. But obviously in communities that you're working in, if you were using this tool, you would want to have, location specific services and tools populate here so that folks would have quick access to that. And in this conversation, with, for example, someone like Kevin, may not be enough just to show the name of the service and the phone number. It may also be necessary to ask him, would you have barriers to connecting to these services? Consider whether or not a warm handoff would be necessary. And that's, in the service world, it's referred to as assertive linkage. And it's really just making sure that you provide a way an additional support if one is needed to have the person connect with that service and supports. Similarly, along these lines, we'll also see if they noted whether or not they needed any sort of other community support. And this could also be where if you know of a recovery community organization or local mutual aid group, you could begin to connect them with those groups as well. In Kevin's case, he has indicated interest in getting support from peers and from online recovery groups. And so we can begin to think about how each of these areas could link to the goals that Kevin set as he outlined in that final kind of goal section, that open-ended part. And, you know, as a recovery navigator, you could have a conversation with him, reminding him that around his current life goals, you know, rebuilding life with a relationship, a house and a job, and the recovery goals focus on reducing his use to save money. And so you can use those goals as a reflection to help emphasize the importance of those goals and the feasibility of achieving these goals, potentially through engaging these additional resources. And so essentially, you know, what we hope you see as we're working through the summary report is that the RECAP provides you with a structured approach to how you can support an individual to achieve the goals and objectives. So in working through these different goals and objectives, it will be important to really discuss with an individual the questions related to actually enacting steps to these goals, right? So it's not just enough to assess and to point out, you know, these are the things you say you want, this is what you want to do, but really what's going to happen in terms of how we will meet these goals? Will these take some time? What kind of planning needs to happen to achieve these goals? Are they realistic, immediate goals, or should we begin to think about some more stepping stone goals to get to those goals? And so that's going to be what we'll talk a little bit about when we discuss the node link mapping as we move forward. And so really, you know, a key part of this recovery care planning discussion that you're initiating through reviewing the summary report is about how an individual can access these resources and whether or not there are groups or people that you as a recovery navigator can help, or if you know of other kind of community connectors in your area that can help make an initial contact and engagement. I know in the drug treatment court setting that I'm working in, they actually, one of the courts decided to use program graduates to be engaged in the assessment of the recap and in the community connection process, because those are the folks who are going to be kind of on the ground and able to connect court clients to relevant recovery supports. They've been through the experience. They know they may have a good sense of what that other person who's still in the program is experiencing, and they may actually have a better sense of, you know, what's going to be appropriate or not, and be able to more assertively link them than say a PO, you know, in a similar relationship, but kind of obviously a very different role with that individual. And so in Kevin's case, we move to areas where we can set more actionable goals. And so these are some specific barriers that were added to the recap as a result of working with the drug treatment court system. They could vary depending on the population you're working with, but these really would be the things that are kind of logistical challenges that get in the way of helping someone get back on their feet. And really any of the items that show up in this section as a result of, you know, how they've answered questions should be discussed with them to make sure that the person has what they need to take those action steps. And in this case, you know, Kevin's case, there are lots of things going on that could be huge barriers in terms of him finding that job, being able to save for a house. And so these are areas where there could be really detailed action plans set out to begin to work with him. To begin to build those resources for recovery. So after that part of the summary report, we next get an overall summary of recovery capital. And really, it's important to, you know, acknowledge that this is a scale that goes from -100 to 100. There's no, you know, we're not, we want people to feel that they have resources and that those things that are getting in the way are things that can be addressed. So even though the overall score is negative in Kevin's case, it could be for other folks that you're working with, it doesn't mean that they don't have strengths. It could be identified and utilized. It really just means that those acute barriers need to be tackled. And so in Kevin's case, because he does have some of the, a certain level of resources, that's where we'd want to identify what we could build on and then where those barriers are getting in the way of his journey that we could address very quickly. And so the summary report does move on to a more detailed breakdown. So it takes this overall recovery capital score and then breaks it down into the various domains of recovery capital. And so here's where we see where some of that low recovery capital could be driven, right? So low social recovery capital. We also see some low other support, which could indicate, they need some more help in these areas in terms of getting advice and emotional support, some new friends and relationships. And you'll notice the recovery capital score, community recovery capital score is 0, which indicates that, Kevin in this case is really not plugged into any community recovery capital supports. And so that could be an area to begin is really what sorts of community recovery capital resources would be most welcomed by Kevin, and how can we begin to link him up with that to help then generate some more social recovery capital in this area. The summary report does move on to personal recovery capital, the score, and then areas of high barriers or high strengths, as well as gives a breakdown of quality of life and satisfaction and commitment to sobriety. And so we can see here that, Kevin does seem to have some consistently low scores as indicated by the numbers, but also kind of in the traffic light system, that red. And so what we can take away from this is, yeah, those are more acute barriers, but he also does have some strengths, right? So he has reasonable physical health. If we look at the table, we can see, a score of 13 compared to kind of an average score of people in long-term recovery, which is a score of 15. He also is fairly satisfied with his house living situation, although not completely. And so really these are areas to kind of reflect and begin to generate ideas of how to support the individual. And of course, it's important to acknowledge, why we have those average scores there. These are from folks in long-term recovery, just as a comparison, and kind of if we were framing this for Kevin, we would say, these are folks that have been in recovery for a long time and they're very stable in their recovery. And so these could be scores to work towards in the future. And you can see where you map onto those pretty well, or where we could, work on getting you some more supports to build those areas of recovery capital. And so really now, the summary report provides that snapshot of all the scores from all the questions they answered. It gives you a sense of where their goals are and where their strengths and their barriers are. But still, that in itself, even though it has a traffic light system, is fairly dry. And it may not be a great way to connect with individuals and begin to actually start planning, right? Because it is still fairly abstract. You get a percent or you get a number, and even though it's traffic lighted, it may not actually provide a way forward. And so this is where node link mapping will come in. And so you'll see as we move through this section of the talk, really a way to begin to visualize what we see in this summary report, and how to kind of work with someone to use those results to move it forward. And so I have to acknowledge these node link maps. The idea is really out of Texas Christian University. They have a ton of resources on their website and some publications around the node link mapping. We've kind of adapted them to meet our needs, but essentially when I'm talking about node link mapping, it's a visual way to organize and present information to really help improve communication and decision making, for that person in recovery and whoever's working with them on their recovery capital profile summary and kind of action planning. And so it should be like pretty obvious right now that this is not a quick assessment, right? You don't just do the assessment and hand someone off with the summary report. If you're really thinking about, building recovery capital from a measure, plan, engage perspective, you need all those pieces, and that can be kind of time consuming. It is an investment, right? It's not a one-off deal. But what's nice about the node link maps is really it enables more of a communication tool, and where you can check your assumptions about some of your maybe questions about, for example, Kevin's experience or other people that you're working with. You can begin to have more of a conversation versus like a one-way kind of diatribe with someone, really providing them, the person you're working with, the person in recovery, a sense of ownership over their goals and how they see their goals shaping their lives. Using the node link mapping, though, can be, even though it is used to guide the conversation, it can be a very structured way to begin to plan, and you can kind of see how things map out and how they change over time. We recommend, saving these maps because you're going to want to refer back to them and add to them as you and the person you're working with see necessary. And it can also provide the recovery navigator with a way to kind of reflect and build their own skills. They may want to kind of reflect on their own navigational skills in working with folks in recovery and see how they've kind of changed and adapted those conversations over time. And so the first kind of map the maps I'm going to show you today that I'm going to use as examples from the fictional case example are guide maps. I think they're the easiest to kind of take and adapt and use on your own. And so these are pre-structured templates, kind of has a fill in the space format that helps to guide the interaction between the recovery navigator and the person in recovery. A lot of the text in the boxes is just going to be open, with the exception of the heading. So we have on the top those green strengths, right? Personal capital, well-being, social capital. And then on the bottom, we have, an indication of those barriers, those acute barriers, so recovery barriers and areas for development, as well as ongoing treatment and recovery support needs. And those may not be acute, but they could be things that, an individual really needs to bring their recovery journey farther along. And then the blue is really this sense of where an individual's short-term and long-term goals are, right? So those are the things that they emphasize as being most important to working through their journey, okay? And so what we recommend is that the node link maps are completed after the person has done the recap assessment and has kind of reviewed the summary report that has the scores and the areas of strengths and weaknesses. And that then this map is used to first, you would want to fill in the goals, right? Focus on what the goals are. And so for Kevin, in our example, that's, to cut down his use and also have a longer term goal of finding a place to live, starting a relationship, and finding a job. And that's kind of where you want to start with the person, is really emphasize those things that are driving them to move forward in their recovery journey, right? And so the rest of the map can be populated by the recovery navigator and the person in recovery, through some of the results that were indicated from the recap assessment. And so what we see here, I know there's a lot going on here. We can see that Kevin may not have a lot of identified strengths. We see, reasonable physical health, reasonable accommodation, although he's not totally happy with it. We see that he has some support from others, including access to resources. But we also see, he really has several barriers to address, right? And so this is where we would want to focus on making sure that all the strengths and barriers and needs are captured, and then you can have a discussion about all these aspects before moving on to action planning. Okay, so this is just like a visual way to take what's in the recap summary and have a discussion around all these pieces. And so for some folks that maybe that they don't want to see their recap summary in the way I just presented it, and that the recovery navigator would actually just take that summary and put it onto this map with the person and then have a discussion that way. Some folks may want to see both and kind of having those conversations and filling out this map with the recovery navigator will help them kind of come up with more ideas. It just depends. I could see either way. And of course, the recovery navigator would want to, be having this conversation and have a sense of where someone's starting to get kind of fatigued and may need to put a pause on the planning and come back to it another day. Because ultimately you want this to be a tool and not to be, totally overwhelming for an individual. So after you complete that first map, there is a second map, and we kind of think about this as a middle care planning map, as it will be used to help inform overall decision making and priorities. And this is really where the work actually begins, because this is where the recovery navigator and the individual will help kind of work together to decide the issues that need to be prioritized and how the prioritization should be done. Okay, so there's 3 maps in this approach that we're recommending. And so this map is really the bridge between the first kind of overview map and the specific action plan that you'll get in the last map, which will address individual barriers and goals kind of at once. So what this map starts to do is give the recovery navigator and the person in recovery a sense of what is trying to be achieved and what the steps and priorities are to make this happen. So to orient you to the map, it actually covers 2 slides because it is so large. So if you were doing this with a person, you would want it on a large piece of paper and not a slide like I have here. But you can see across the top is the priority area category, then a description of the need or goal, then some ideas around how to achieve that goal. And then, ideally there's some sort of broad timeline on a date to achieve that goal. And then what you'll see on the left-hand side, which are these different rows, again, using the traffic light system, the colors can really help make connections pretty quickly. The first row would be those, acute barriers and needs. The second row would be those strengths to work on. And then that would be followed by those short-term goals and those long-term goals, right? And so, I'll give you a broad overview and then maybe I can work through one of these kind of rows individually, just to kind of help orient you to the node link map. So for Kevin, really what we want to do is start distilling down to finding his long-term priorities, his house, new relationship, eventually abstinence, and having gainful employment and some positive mental health, and really begin to translate this into action plans for him. And so what I do want to say, although we have, goals and objectives, we don't want to be too ambitious. The aim is really to make sure that there are things that Kevin can achieve through the guidance and support of a recovery navigator and their network. So not something necessarily on their own, but really using this as a stage to identify what the goals are and how the recovery navigator can support the creation of a meaningful and realistic plan for achieving those objectives, right? And assessing, maybe where things were too lofty, if you return to this map and reassess it, and then, having a discussion around that so that you can make a more realistic map for next time. And so if we look at, the barriers and needs here, we think about the first one, ongoing substance use, as the need, how to achieve that goal, would really be beginning to look at the treatment that's received, right? And seeing what else might be needed. And then just having this broad, okay, by 3 months, we want to make sure we've reviewed that, right? And so for each of these, there is a need or a goal that's like pretty succinct, and then 1 or 2 steps towards achieving that goal, and then some sort of potential timeline to address that goal as well. And it's similar for strengths, and then also similar for short-term goals. So if a short-term goal is for him to improve his housing situation, one initial step would be to review recovery housing options, because that could be a great place for him to start. And then for him to have done that by the end of the month. And having a discussion around what the best way to review those recovery housing options would be part of this conversation. And it's a similar process for those long-term goals, although really you want to keep those those action steps, make those as easy as possible to achieve in that timeline, so that people don't get discouraged if they don't achieve those objectives in the time frame that they've set for themselves. So now I bring you on to the final map. So in this approach, there's really these three maps. That first one that gives a broad overview from the recap summary. The second one, which begins to kind of set those priorities. And then the third one is this actual setting a goal map and creating specific ways to address that goal. So in this presentation, I'm only obviously showing one example, but really what you would want to do is do this for each of a person's priority goals. And so there would be several of these setting a goal maps. There would be one for each of those goals. And this is where we really begin to transition to action planning. And so in Kevin's case, as you can see here, we're going to focus on his goal of stop drinking and using cocaine, so stopping his substance use. And so a recovery navigator, Kevin, would begin by writing that right in the middle there, and then kind of work out from there, right? And so we would think about asking about helpful people and useful thoughts that could address his ability to reach that goal. Strengths that he may have or need to reach that goal, right? Some specific actions towards addressing that goal. So in this case, he's going to work on changing his friendship networks and stay away from his old friends. And he'll do that by making new friends through engaging in recovery groups and engaging with his probation officer to help him do that. And then he has kind of specific times of when he's going to be doing these different activities. And so in his case, it would be do not answer the phone for old friendship networks. And that would be a specific action to kind of help him begin to stay away from those friends who are barriers to him. The map also, it does take the approach of recognizing there may be problems or barriers when individuals begin this process of achieving this goal. And so, having the person, in this case, Kevin, the fictional case, Kevin, indicate what potential problems could arise is really important. And then also talking through potential solutions. So not just recognizing those problems, but addressing potential solutions, right? And so this map really is important for three main purposes. It allows a recovery navigator to kind of detail the challenges that need to be overcome, as well as kind of providing a record of suggested supports that could be needed to achieve a specific goal. It should begin to help build a partnership of trust with that person that they're working with, because it is something that should be completed collaboratively. Right? Like I would recommend, when they've listed their goal, they can write it out if they want to, or the recovery navigator could write it out for them. But having that conversation, asking, well, who are the helpful people and useful thoughts, asking about each of these things. So they're kind of reflecting and thinking about all these areas themselves with the recovery navigator as the guide to work through the model. And as should be apparent from this example, but also in folks that you're working with, many of the goals and challenges are going to be things that are kind of interlinked together, right? And so the obstacles in this case that Kevin perceives to achieving his sobriety are partially about his lack of personal resources, the nature of his social network, and his lack of access to recovery groups and supports. And so having solutions to kind of link these meaningful activities to these things may help to solve problems kind of across the board, right? And so it's really helpful when working on this to have a time frame for each of these actions so that you can reflect on when this is working and when this is not. So as I mentioned at the beginning of talking through the map, it should be repeated for each of the priority goals, but it's really important that the person in recovery doesn't become overwhelmed by what they see as unrealistic or inaccessible goals and action items. So obviously, like if they have 5 goals and you're doing a map for each of those, it could be that you have 5 sessions or more to kind of work through each of these. You want to do it in a time frame that works for them. And in most cases, a recovery navigator is not in the role of a clinical therapist or counselor. And so a key part of the role for the recovery navigator is really going to be negotiating those boundaries and how to determine where and when they can contribute to the process and where they need to transition into more of an assertive linkage model without kind of destroying the relationship that they have with the person in recovery. And so with all these documents as well, we recommend that they be live documents and that they be used in kind of catch-up sessions, and not just like done and filed away, but really used for the individual and the navigator on an ongoing basis to really reflect the experience and how it could be improved and provide that kind of ongoing feedback for the individual. And so I know I've covered a lot, and I'm going to jump over this question section, but we'll have a little bit of time at the end, I think. I just want to make sure I get through the rest of the slides. And so the last piece about the recap is really taking these action plans and using them as a way to engage in the community and connect the person to the community. So an individual cannot do this on their own, but the staff cannot do it for them, right? And so the recovery navigator that is working with this person needs to be a bridge to those assets to help link them up, but can't be doing it all for them. And so obviously starting with like peer organizations and local community groups can be a great way to kind of get some more community level supports wrapped around that person. But again, it will involve kind of being flexible and adaptable to thinking about what their needs and readiness are, as well as their kind of larger goals and aspirations around the type of things that you want to begin to connect them to. And so what we recommend in this approach, if you're thinking about this from kind of a systems level and really trying to create more of a community recovery capital ready framework for folks, is asset-based community engagement. And so I recommend reading this paper by Collinson and Best that really dives into how to do asset-based community development. But so essentially what this does is you use a asset mapping in your community to identify where folks are currently engaged and where they could be engaged in the future, and how accessible, affordable, connected, and what ability these assets have to develop further social networks. And so ultimately, this could be used as part of that recovery care planning process, where the recovery navigator has done this mapping. Maybe it's part of an organizational level mapping, and it's part of the resources that organization has to then the recovery navigator can use to support their work with the individual. And so essentially, and I obviously don't have time to dive into that, could take its own session on asset-based community engagement, how to do it. But for the recovery navigator or for programs that are interested in doing that, it's really drilling down into 5 primary questions. What are the key organizations and groups in your community that could be used in this way to support a person in recovery? Who are the community connectors? And if there aren't community connectors, who could we develop into being community connectors to create that assertive linkage that's kind of natural and sustainable? What should be done to prepare an individual or kind of groups of individuals to make that connection? How are you going to test the effectiveness of these matches, right? How are you going to test the effectiveness of whether or not people are effectively engaging, and what are results of that engagement? And then how do you build on this success, right? How do you think about this as a dynamic process of assertive linkage and community engagement? And how do you begin to use that to kind of further develop your community as a recovery supportive community? So I know I only have a few minutes left for questions. So I really, as I'm closing, I did want to go back to like why we're doing this, right? It's not just to support the person in recovery, but if we really think about building recovery capital from a broader community perspective, what we will see is improved community well-being as individuals build their recovery capital. They themselves are going to be healthier, their family is going to be healthier. That's going to trickle out into their larger social network. And ultimately, we should see that trickle out into the community. And David Best and Johanna Ivers have written about this in a nice paper that came out in 2021 and referred to as kind of the ice cream cone model, which is a nice way, I think, to remember this idea, in that the community well-being are kind of the sprinkles on top in terms of how we build recovery capital for an individual and how we see those benefits going well beyond that individual. And so I did want to mention a few APA resources. There is a podcast, the one I've highlighted in the link here is specific to, opioid use disorders, but there are a variety of others if you're interested in podcasts, and then there are several other resources there. And then obviously the references are there. I know I've talked about several articles, and if you are interested in any of them and don't have access, I'm happy to follow up with I could email individuals access to specific articles if that was of interest. So now I see I have 5 minutes left, and I haven't looked in the chat in a little while, so I will just review any questions that are there, and I'm happy to take questions until the very end. Okay. So I have a question. Could you please briefly explain the difference between recovery navigators and the client's primary substance abuse counselor? Yeah, it's a great question. And I think this is where there could be an opportunity for overlap. And so when I'm talking about recovery navigators, it's really someone, it could be their substance abuse counselor if there is time for that, but it may also be someone who has the ability to kind of engage more kind of broad assessment of where an individual has recovery capital or doesn't have recovery capital. And so this could be, a peer recovery support worker or another, even a fellow peer in a recovery residence, that has the ability to really think beyond the substance use and think about some of those other areas of quality of life and well-being and access to resources and barriers that an individual encounters that may not be covered by a counselor position in kind of like the medicalized treatment model, or it could be. I think it will depend on the program and the treatment setting. So that's a great question. And I think it's going to involve a lot more thought kind of across the system level to think about how we create recovery ready treatment services in specific areas. The next question, let's see, the big obstacle I found when building support for the client is a lack or a long waiting list of community resources. What could be a possible solution? It's a great question. And I think that really comes down to if you haven't had the opportunity kind of at the system level to begin to engage in that asset-based community mapping, because I think that is where communities will find there are a host of untapped resources that there just aren't those systematic linkages to, but there could be through some more sustained systematic supports. And so doing that mapping can be a great way to identify those resources for folks. And then I have a final question looking for an example recap. And there isn't one published, and I would need to just double check that. I mean, I have several that I could share. I would just I can say the system that I've used is the REDCap system. I can put it in the chat because it sounds like recap. And this is it's an online programming environment that essentially allows people to take the survey and then also generates those automatic score summaries. And I use this through my institution, through Mass General Hospital. I think nonprofit organizations can create accounts and develop it and use put a recap into REDCap for use, so you can get those automatically generated summary reports from folks. So I'm happy to email something out afterwards if you want to shoot me an email. I'm just gonna put my email in the chat here. And I think Rebecca has put information in the chat about getting certificates after the webinar. So unless there are further questions, I just want to thank everyone for joining me today. It's been a pleasure. Some great questions, and I'm happy to follow up with some of you later on if you have more questions.
Thank you so much, Dr. Hennessy, for all of the information you shared with us today. I have a couple of items of business before we conclude today's webinar. We have included Dr. Hennessy's contact information so that you may contact her with any further questions. And once again, Dr. Hennessy, we just really appreciate all the work you put into this. These are always great. Everybody always gives you great reviews and everybody enjoys learning from you. So thank you so much again for giving us all of this information. And if everyone wouldn't mind, you can see the chat panel for a link to today's survey. Additionally, when I conclude today's webinar, your browser will take you to an evaluation on FADA's website. If you want to receive CE credits or statement of credit for this event, you must fill out the evaluation. You will be prompted to register or sign in to complete the evaluation. You can register as a visitor at no cost for CEs to be reported to CE broker for Florida licensed healthcare practitioners. You must have provided an accurate Florida Department of Health license prefix when you registered for today's event. After you register or sign in, you will be directed onward to the evaluation. You must use the same email address you used when you registered for our webinars and when you set up your profile in FADA's system, as this is the only way to connect your attendance and your profile. You will get a second opportunity to complete the evaluation through a follow-up email later today. The evaluation will close midnight on Monday, September 5th. Please note that we do not email statements of credit. Instead, after we verify attendance and completion of the evaluation, a statement of credit will be generated as a journal entry within your profile 30 business days after the evaluation closes. Thank you so much for participating in today's webinar. We'd also like to recognize and especially thank the Florida Department of Children and Families, Office of Substance Abuse and Mental Health for funding today's education. And please make sure you see the chat panel for a link to today's evaluation. You must take the evaluation in order to receive CE credits. You will need to register or sign in before you can take the evaluation. Thank you all so much and have a great day.